All right, I've got the privilege to introduce our speaker. Mr. Jeff Davis is the current CEO and Chief Operating Officer of Brand New Day. Brand New Day is a Medicare HMO in 12 California counties, serving over 32,000 Medicare members and growing by over 700 new members every month. Brand New Day is a family business and has been providing health care service to many communities in California since 1983. Mr. Davis' initial experience as a healthcare administrator involved working with his father and brother, and that's how he learned the HMO business. Brand New Day is known for its innovation and development of strong members and implementation of provider support programs assisting members in the management of their chronic diseases. Brand New Day is also known for its successful and innovative programs developed to service the seriously and persistent mentally ill patient population. Mr. Davis earned his degree in Business and Economics at University of California, Los Angeles, UCLA, and is certified as a public accountant. Again, it's with great pleasure I introduce your speaker, Mr. Jeffrey Davis.
So good afternoon. So congratulations on completing your education to become a registered nurse. In our company's opinion, RNs are the jewel of the medical field. During most of my career, I've worked at our family-owned HMO with my father, brothers, and sisters. And I think most of you and your families will be happy to hear that you're entering a full employment career. My father always said that when the economy is good, people get sick and need care. And the good news is, when the economy is bad, people get sick and still need care. So you're in a good career, and you'll be able to work throughout the entire country and reality, the entire world. Right now, our country is dealing with great change in the delivery of health care. The government is attempting to move the delivery of medical care from a volume-based model to a value-based model. This means this is the payment model that HMOs, what we do, have been delivering for years. Volume-based care means doctors and hospitals get paid for performing tests and procedures. Reimbursements for performing preventive care and managing patients' chronic care results in better care and better outcome for patients, but less money for the doctors and hospitals. Since the reimbursement for preventive care is low, support systems support the needs and for these kinds of services are not really in place. In a value-based reimbursement model, money is allocated to develop systems to promote prevention and support programs for managing chronic conditions. The Accountable Care Act, or Obamacare, was put in place with the overall intention of changing the American healthcare system to a value-based system, one that improves the overall health of the country, which will result in better care, better health, and lower costs. At Brand New Day, we've developed a number of programs to support primary care physicians, patients, members, and their caregivers to give support of chronic care management. Our reimbursement models support the value-based delivery. We developed a long list of programs for individuals with diabetes, CHF, COPD, hypertension, CKD, dialysis, on and on and on, to help people with their chronic disease. We've also developed a program to help people with serious and persistent mental illness. In these programs, we developed individual care plans that help support the member. We work with our members to understand their medical conditions, and educating the members, something that you guys learned a lot of. We talked to them about nutrition. We work with them on medication adherence, on exercise, on linkage to community resources, on preventive health. In addition, we have RN case managers assist members with complex medical conditions to assist them to navigate the often difficult times and systems in the healthcare delivery system. Brand New Day programs are managed by MDs, RNs, and LVNs. The key to these programs are the jewel of the healthcare system, the RN. And the RN is going to play a major role as this transformation happens from a volume-based system to a value-based system. We view the RN as an integral element for the country to improve the overall effectiveness and quality of health care while helping reducing costs by supporting prevention of disease. And at Brand New Day, we value the work and the knowledge of the RN. I talked about the RN as the jewel. When you put a light on a jewel, you'll see it glow. When all of you right now are glowing. When you shine a light on a gem, there's light beams that come out in multiple ways. With the light on you, I hope right now you see light coming in multiple ways. One of those lights will show you the numerous and thankful, and sometimes not so thankful, individuals and families you will help to improve their health care. For many of you, this is why you chose to go in the nursing career. The light will also show you what's happened in the past. And I hope you'll see a lot of hard work and learning to become an RN. You'll have friends, which I think has been shown that you've developed in your learning. You have fun, you have family, and overall enjoyment of life, and that's what you want to make sure you keep going. Going forward, your light is bright and has lots of opportunities to expand in your career. You have a lot of paths to go in medicine, and I recommend you expose yourself to as many of those paths as you can and choose one that works for you. The healthcare industry is challenging and stressful. I also want to recommend that you follow your light to the future and build your career, and you take care of yourself, of your own needs, and allow yourself to have a successful career, but also a healthy, happy life. And that sometimes can be a tough balance. Religion in this school is important, and my family is Jewish. And so in closing, what I want to do is read a very thoughtful blessing that our rabbi gives to graduates. And so the blessing goes like this: may all of your learnings lead to wisdom. May all your labors lead to success. May the path before you lead to blessings. May your studies never cease. May your prayers be answered. And again, I want to congratulate everybody on your accomplishments to get as far as you have, and wish you all a successful, happy future. Enjoy the rest of your evening. Thanks.
Stay right here for 1 second. Thank you so much, Mr. Davis. I want to call Dr. Marilyn Uvero up for a second to present you with a plaque.
Pastor, you please join me
Yeah.
and have some thoughts
Yeah.
about Jeffrey.
Yeah. You know, many of you don't know, well, you probably don't know, but Jeffrey, Mr. Jeffrey Davis and his dad, Howard Davis, they actually were the ones who sold us the building that we have in Signal Hill. Give them a hand. Give them a hand, seriously. And the reason that that's significant is that wherever you go, you're going to meet people that will help you. And I think one of your speakers said it, just go with that flow. I remember speaking with his dad many years ago because my wife wanted the complex. And his dad is a man of vision. He's self-made, Jeffrey, his family, they built that company on their own. They built it through faith and hard work. And whenever you meet someone that God brings into your life that makes a dramatic change, look at that moment as something that's precious. For me, Jeffrey, his sisters, his brothers, his dad, they are precious to my family, and they should be precious to you, because if it were not for the faith that they had in us, if it were not for the faith that they had in the dream that my wife and I had, if it were not for the trust and the confidence that they placed in us, because it's not easy to deal with me, we wouldn't be where we're at today, and you guys wouldn't be sitting here. So I just want to say to Jeffrey while he's standing here, I love him. I love his family. I love the things that God is doing for him. I know that God is going to bless him more and more and more in everything. So give him a big hand. Stand up and give him. Stand up and give him a big hand. Come on, stand up. Stand up and give him a big hand, because if it were not for him, we wouldn't stand up and give him a big hand. If it were not for him, stand up and give him a big hand, because if it were not for him, we would not be here. We would not be here. God chose him and his dad and Jeffrey's faith in us. So Jeffrey, I want to thank you. Amen. Amen.
Jeff, you now see how valuable you are to your future
Yeah.
and to the future of our university and our future graduates of American University. So I have to really, your faith, support of minority health, and what God has granted us, American University of Health Sciences, we present this to you, Mr. Jeffrey Davis, on the first day of June, 2018.
All right.
And we thank you so much. Woo!